Hi, my name is Lucie Song.
Hi, my name is Klaudia Zalewska, and our project is on the metabolic profiles and urinary concentrations of phenols and phthalates in mother-infant dyads.
Phenols and phthalates are two classes of ubiquitous organic compounds that can be found in hundreds of consumer products, including PVC pipes, medical devices, food packaging, personal care products, cosmetics, and toys. Because phenols and phthalates are not covalently bound to plastics, they easily escape into the environment through evaporation, leaching, and abrasion. They can then be acquired by humans through ingestion, inhalation, and dermal absorption, and proceed through various metabolic pathways. These compounds can then be absorbed by any part of the body and can even cross the placenta, resulting in maternal to fetus transfer. The multiple sources and exposure routes make phenol and phthalate exposure pervasive in today's consumer society.
Exposure can impact the metabolic processes of the endocrine system, which may result in hormone imbalances, cause reproductive issues, and lead to cancers such as ovarian, breast, and endometrial. Women exposed to phenol and phthalates in varying trimesters of pregnancy have an increased risk of developing hypertension, preterm birth, and gestational diabetes. Infant exposure is associated with an increased risk of developmental delays, including physical and behavioral impairment. Studies of these exposures during pregnancy and maternal and infant metabolism are scarce. To investigate the associations of phthalate and phenol chemical exposure with infant and maternal health outcomes, we conducted a cross-sectional study on 72 pregnant people and 63 infants in Cincinnati, Ohio.
A cross-sectional analysis on the chemical exposure of the mother-infant pairs was done, analyzing 8 phenol and 9 phthalate metabolites in maternal urine samples, excluding metabolites found to have exposure from medical tubing and delivery. Out of 75 mother-infant pairs, phenolic and phthalate metabolome data was available for 72 maternal serum samples and 63 cord serum samples. Associations between phenol and phthalate concentrations in maternal urinary samples and maternal newborn metabolome data were assessed using linear regression adjusted for maternal and newborn factors, while accounting for multiple testing with the Benjamini-Hochberg method to control for false discovery rate, with the false discovery rate set to 0.2. A functional analysis was then performed to identify possible biological pathways.
There are various significant associations between phthalate and phenol chemical exposure and the metabolome in the data analysis among the mother-infant dyads, indicating that the potential adverse health outcomes are related to the exposure. Precautionary measures to reduce exposure to phenols and phthalates are recommended to the most vulnerable populations.
There is evidence supporting the role of phenol and phthalate metabolites as endocrine disruptors, but future studies on the metabolome are needed to investigate pregnancy outcomes and examine long-term effects on the metabolic system of mother-infant pairs.